Let's take another issue where the governor has certainly outlined a position, and there's a lot of pushback on it from particularly the healthcare community. Medicaid expansion under the Affordable Care Act. Mm-hmm. The governor has resisted doing that. You and Democrats have pushed for it. The Chamber of Commerce and other business interests, and particularly the hospitals, have pushed for a third way, if you will. Negotiate something with the government that would not be Medicaid expansion necessarily, or might not be called that, but would be something else that some other states have managed to do. Are you confident that can be worked out, and do you think the governor would support it?
I recognize that there have been partisan debates about Medicaid expansion from its inception, but I think the reality is we are facing a critical state for our rural hospitals, for our families, for our military families who are being denied access to health care, and for economic development in the state. This is a jobs bill. Expanding Medicaid, and we can call it the Arthur Laffer Healthcare Access Program. I don't care.
Arthur Laffer, one of the brains behind supply-side economics.
Exactly. And if you take his theory, if we supply to our communities access to health care, if we give opportunities to our families, many of whom are working families. They go to work every day. They simply make too little to qualify for regular insurance and make too much to qualify for the $7,000 threshold for Medicaid in Georgia, and they are left behind. We're talking about 15.8% of our population, 300 to 470,000 people who, with access to health care insurance, would be able to go to work every day and not worry about losing their jobs.
You're not afraid, though, of a cost explosion at the back end when federal contributions to this expansion would be less?
So the way it works is that for the first 4 years, and unfortunately we're about to miss the window, it was 100%. The next phase, it's 95% federal, 5% state. When that evaporates, we drop down to the terrible number of 90% federal, 10% Georgia. So by 2023, Georgia would have to put in roughly $2.1 billion. But the return on investment is more than $6 billion a year to the state of Georgia, more than 56,000 jobs. I mean, Kia generated 3,000 jobs, and we celebrated that and spent 20 some odd $1 million to bring it here. For an actual cash return, we would get jobs, we would get health care, we would get hospitals that are stabilized. We have rural communities where if they lose those hospitals, they lose 33% of their economic development. This is no longer a partisan conversation. This is a people conversation. This is a monetary conversation. But more than that, I think that both Governor Deal and the Chamber of Commerce recognize that healthcare access has to be a priority if we want to continue to attract jobs.
Have you had conversations with leaders on the other side of the aisle about a third way, a compromise?
We have had conversations about the importance of funding healthcare access in Georgia. Medicaid, whether we call it that or not, is the pot of money that we have to draw from. And so I want us to be very clear that there are very limited ways to fund this program. I have no problem funding it by calling it Medicaid expansion and fully reaching the 138%. There is certainly a conversation to be had about looking at waivers. I think waivers are a difficult navigation point, but states across the country have found ways to do this. No one would accuse John Kasich of being a liberal. No one would say that Arizona is a liberal bastion, and they both have figured out how to do this. Indiana, Arkansas, Alabama is talking about doing this. And so I think we have to recognize that however we do it, and we should have a Georgia approach. We should recognize that Georgia's differently situated. But I think what we cannot do is continue to pretend that there aren't real consequences for people, for families. Specifically, we have 25,000 military families, 25,000 who are not able to access health care because we have refused to accept the funds necessary to give them services.